what would you encourage them to do?
Pray to the Lord and I will hope that your child will survive cancer.
Did you survive cancer?
Oh, yes.
That's Dempsey. I could just put the mic down now, right? Okay. Yeah. But I've been asked to share our story, and I just want to kind of paint a picture, and I have a short amount of time, so I'll try and harness my passion for a minute. Dempsey was diagnosed with leukemia, pre-B-cell acute lymphoblastic leukemia, in April of 2016. And to say that I was in shock at the beginning would be a gross understatement. God kind of benched me for a couple of weeks because Dempsey also had a secondary infection called mastoiditis, deep inner ear infection. And he was on a ridiculous amount of drugs to help with that, and we had to treat that a little bit before we could even address the cancer. And he was 80% cancer in his marrow. So leukemia doesn't necessarily have stages. So the percentage of cancer in the marrow is kind of how I measure the severity of his disease. So 80%, that's pretty insane. Prior to diagnosis, Dempsey would take a shake every day, and he enjoyed the kids' chewables or the chewable vitamins, the VitaGuard, the VitaSquares, the All-C. He was active. He was never really sick beyond a runny nose, and he never had any health challenges. So when he got cancer, I was dumbfounded. It made no sense. It should have been me, should have been my husband. We were more likely to have that than our little kid. The doctors said, no supplements. Excuse me, what? And I should let you know that a month to the day before Dempsey was diagnosed, I received my holistic nutritionist certification. So to tell me that I can't supplement my kid, you out of your mind. So that not being my first rodeo, I asked, okay, no supplements, got it. What are his whole food restrictions? What do you think they said? None. Get out. I'm just letting you know, this weekend, just today alone, you all have had more nutritional education than all the white coats that I have had in my life, okay? So pat yourself on the back, give praise to God, thanks Neolife, and this is amazing, okay? You are all prepared to handle a cancer journey. So no, I don't want anyone telling me I can't do it. You think you can't do it, you contact me and I will set you right, okay? Because you can. So the plan of action that I used for Dempsey was to use organic, non-GMO, whole food nutrition and other complementary methods to protect Dempsey from the side effects of the drugs. Since we couldn't protect him from the drugs, I want you to understand that. We couldn't protect him from the drugs. We were legally mandated to poison him. We had no choice. We were threatened with CPS if we did not comply with the standard protocol, okay? This is a national protocol. So we opted to protect his body from the side effects of those drugs, okay? We couldn't protect him from the drugs, so I decided to prime and protect his body from the side effects of the various drugs. The drugs, mind you, he had 10 different chemotherapies, 4 sedatives, 2 antibiotics, 2 steroids, 2 diuretics, 2 laxatives, 2 anesthetics, 2 antacids, 1 narcotic. He had glucose elevating agents. He had electrolyte replenishment, antiemetics, those are the anti-vomit medication. He had one of those, 1 anticoagulant, and 1 antihistamine. This is 31 drugs. 31 drugs, okay? And there are no protocols in place to protect his body from the side effects of those drugs by the white coats. None, okay? He had he had close to 20 lumbar punctures, 3 bone marrow biopsies, countless infusions, and thousands of pills, okay? His treatment duration was 3.5 years, We ended it 6 months early. That took us moving states, by the way. We now reside in Idaho. So his situation today, he's thriving. You saw him. His shirt says Thriver on it for a reason. He had 0 negative side effects of treatment. Are you listening? 0. No neuropathy, no mouth sores, no fatigue, no vomit, no constipation, no diarrhea, no ringing in the ears, no colds, no fevers, no muscle or joint pain, no digestive issues, no cardio issues, no insomnia, no loss of appetite, no cognitive impairment, and no respiratory issues, etc. Praise God. And just for a little bit of reference, I have statistics for childhood cancer patients. 490% increased risk for death from lung-related causes. These are going to be all the secondary issues these poor kids potentially will be affected by the time they're 45. Okay, 250% increased risk for metabolic dysfunction, so stuff that Yvette was just talking about, okay? 950% increased risk for severe cognitive dysfunction. 1,400% increased risk for cognitive heart failure. 740% increased risk for kidney failure or dialysis. Not on my watch. So, and then, I had the protocol too of all the things that he took. Let me go back to that. Where was that? So products Dempsey took: acidophilus, aloe vera plus, carotenoid complex, CoQ10, lecithin, treonin, vitamin A, vitamin E, all C, Vitagard, Vitasquares, cruciferous plus, flavonoid complex, Neolife shake, Neolife bars. If any of you want to know how much he took, for how long he took, or how we did this, come see me, and I am more than willing to talk to any of you. And you can take my name, you can take my information, you can pass it on to anyone who ever finds themselves in this situation. Thank you.